Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. The United States government announces $2.1 million support for Nigeria to conduct surveys to determine extent of COVID-19 transmission in Gombe, Enugu and Nasarawa states. National Association of Resident Doctors honor members who have died on the front lines in the fight against COVID-19, hails Delta State Governor for passing the Residency Training Act. And COVID-19 infections in the United States continues to rise as cases near 7 million mark. Now, 6 months after the World Health Organization declared it a pandemic, the coronavirus is surging in many countries, and some that had apparent success in suppressing initial outbreaks are also seeing infections rise again. But the number of confirmed cases during the initial peak is likely to be an underestimate of the true level of infection, as widespread testing is not available in many countries. Now, among the global regions driving the numbers is India in Asia. The virus appears to be spreading much faster in India than elsewhere, with the country recording about 90,000 cases a day in early and mid-September. The rise in infections comes as the government continues to lift restrictions to try to boost the economy, but the surge is also a reflection of increased testing. In Latin America, Brazil has the highest number of deaths, with nearly 140,000 so far. It has also recorded more than 4.5 million cases, the third highest in the world. Newly confirmed cases in the region are also rising quickly in Argentina, which now has more than 600,000 infections. In the Middle East, Iran has been badly affected by the virus and confirmed its highest number of new cases since early June earlier this week. Cases are also continuing to rise in Indonesia, and the country has recorded 10,000 deaths, the highest number in Southeast Asia. In Nigeria, the Nigeria Center for Disease Control confirmed 125 new cases that were recorded in 12 states and the FCT last night. Lagos was top with 37, followed by Plateau 18 cases. The FCT recorded 17, Ogun State recorded 15, 10 in Rivers, 7 in Benue, 7 as well in Kaduna. Anambra State recorded 5, Oyo 3 cases. 2 each were recorded in Cross River and Ondo, 1 each in Edo and Imo State. Till date, 57,849 cases have been confirmed and 49,098 cases have been discharged, plus the death toll is at 1,102 recorded in the 36 states and the FCT. The United States government, through the U.S. Centers for Disease Control and Prevention, is supporting the government of Nigeria with $2.1 million to conduct a household survey to determine the extent of COVID-19 transmission in the states of Gombe, Enugu and Nasarawa. The survey is expected to increase the current understanding of COVID-19 transmission and burden in these 3 states and inform the COVID-19 response efforts of the government of Nigeria and its partners. The US CDC is funding the full cost of the survey and providing technical assistance as part of the U.S. government's bilateral efforts to improve the health and well-being of the Nigerian people. The survey will estimate the proportion of the population in these states who have ever been infected with COVID-19, the virus, of course, responsible for the pandemic. Now, according to the National Association of Resident Doctors, the coronavirus pandemic has brought a new challenge to medical practice in a very poorly funded healthcare industry. While remembering their colleagues who have died on the front lines in the battle against the virus, the resident doctors thank the governor, Dr. Ifeanyi Okowa, for domesticating the Residency Training Act in the state, calling on all of the governors who are yet to do so to make sure that they domesticate it. It was at a 3-day conference and 40th annual general meeting of the association, which held at the Delta State University Teaching Hospital.
It's the 40th annual general meeting and scientific conference of Nigerian Association of Resident Doctors, NARD. The 3-day conference brings together resident doctors and stakeholders in the health sector to deliberate on issues affecting the sector, especially during the coronavirus pandemic. Coming against the backdrop of the COVID-19 pandemic, this meeting offers a good opportunity to review the ongoing national efforts to combat the epidemic, as well as assess the nation's readiness to respond appropriately to future public health emergencies.
Your calling is increasingly becoming humanitarian.
Chairman of the occasion and former governor of Delta State, Chief James Ibori, commends Governor Okoa and the former governor, Emmanuel Duan, for conceiving the idea of building the technical hospital in Ogara. He reminds the doctors of their health duties to humanity, especially in this COVID era.
The role you all played and are still playing in the ongoing COVID-19 global pandemic puts you at the vanguard of salvaging the human race. You remain at the front lines, risking it all to save humanity. I commend you all.
Congratulations for the governor approving the 2017 training program. But like James said, there must be money involved. And when it comes to money, it's not easy to convince a governor. But that the governor has approved it really shows one thing, and that is every state should have governors that are doctors.
Host Governor Dr. Ifeanyi Okowa, while highlighting the achievements of his administration in the health sector, calls for the adoption of a viable, sustainable healthcare financing program for states in the country.
Each state is primarily responsible for the financing and implementation of its healthcare system. A healthcare financing program that is focused on upscaling primary healthcare services, enhancing of human resource for health capacity, deployment of a technology-enhanced healthcare service delivery process, and improved access to measurable quality healthcare service outcome for all is imperative.
At the high point of the event, Governor Okowa is given awards as the ambassador for state health tertiary institutions in recognition of his contributions to the National Health Act and implementation of Residency Training Act 2017. The governor also takes time to inspect ongoing projects at the teaching hospital, expressing his administration's readiness to extend same to other health facilities in the state within the limits of available resources.
The Adamawa state government has expressed concern that in spite of the efforts of the COVID-19 Containment Committee in creating awareness, the majority of the people are still skeptical about the existence of COVID-19. According to the Adamawa State Commissioner for Health and Human Development, during a sensitization program organized for senior officers of paramilitary outfits in the state, there is a possibility of an upsurge of COVID-19 if strict measures are not taken to mitigate community spread.
Adamawa State is not letting down its guard despite reports that Africa is in good stead in the coronavirus fight. More awareness is ongoing as the State Ministry of Health collaborates with UNICEF and other United Nations organizations in conducting a one-day program for security outfits in the state. Gathered here in this hall are officers drawn from the police, Nigerian Correctional Center, Civil Defense, Immigration, amongst others. They are here to learn more on the need for continuous adherence to the COVID-19 protocols in their various departments. Presentations are made by the World Health Organization and UNICEF.
It means they have up to 300,000 cases.
The Director of Public Health, who is representing the Commissioner of Health, gives reasons for the skepticism by the people, while the Incident Manager for COVID-19 in Adamawa State expresses worry over community spread.
We need to enlighten. We need to sensitize. We need to go to every nook and cranny of Adamawa State to tell them that this disease is still ravaging our people.
So I think we need to ramp up health education, community engagement, capacity building within the community for community leaders and religious leaders so that they can speak to their people.
The UNICEF representative appeals to the people to protect themselves from being infected by the virus, while the participant describes the interface as very educative.
First, let's prevent ourselves from the COVID-19. And then developmental works, other works, we can continue. But the priority is to protect ourselves wherever we are. Let's protect ourselves, let's protect the people around us.
With this workshop, I've really gotten to know that it's actually on the surge. It's still prevails, it's still on. COVID-19 is still a fight that has not been brought to a finish. We're still fighting it.
It's expected that participants in this interface on COVID-19 pandemic will cascade the information gained here down to their various security formations so as to improve on observance of the COVID-19 protocols in their different organizations.
A public health physician, Dr. Shalom Oni, joins us now for more on Flattening the Curve. Thank you for joining us on the program.
Thank you, Millicent.
So there's a lot of priority with regards to awareness campaigns and the non-pharmaceutical measures. But then we know that several other countries around the world are opening up. Africa is as well. With regards to our public health facility, which should be a priority, 6 months now, and seeing that there are risks with regards to the spread as we open up. Are we there yet?
As a nation, I don't think we are there yet where we can really say we are able to curtail, peradventure, if there's a second wave of this pandemic or if there's another pandemic. I think by and large, in the last 6 months, we've only responded, to the outbreak, and not much of the strengthening of the public health structure. We're talking about the strengthening. We're talking about personnel, more personnel. I've not seen recruits in the last couple of months. You've seen doctors going on strike, nurses going on strike, and things like that. That's taking place in the last 6 months. Salaries, allowances being held. The only way we can say we build capacity is the aspect of testing, where we have molecular labs being opened up every day across the nation, and the introduction of gene expert testing and things like that. But overall, in terms of strengthening the public health facilities, so I'll be able to curtail a second wave or another pandemic, I don't think we are there yet, because the health workers are just managing to be able to respond to this COVID-19. In fact, kudos to all the health workers in the government hospital. Many of them work without adequate PPEs. Many of them eventually along the line were victims of COVID-19, and some of them are even returned back to work. So I still want to put a lot, at the doors of the government to see how we can use this season to strengthen the public health facility and, the public health structure.
According to the World Health Organization, about 80% of people in Africa are asymptomatic, and they're suspecting that, there might be a lot of community transmission ongoing in rural areas. So perhaps we need more awareness, taking it to those areas. But are you worried with regards to, the population that we have in Africa and the fight to COVID-19?
A little bit, because I think we have more people living in the rural areas, that we have in the urban. So if what we have in the urban is this thick, I think there is a need to worry about what is going on in the rural areas in terms of sensitization, in terms of awareness, in terms of facilities, in terms of infrastructure. Many people want to work. There's this rural urban migration. So how many of the health workers and health facilities do we have in the rural areas where we have many of these people, many of this population? And in the last couple of months, there have been intercity transportation, and some degree of transmission is already ongoing there. But what is the testing level, in these rural areas? Where are the molecular labs in the rural areas? Where are the logistics to ensure that, okay, the testing in rural areas gets to the urban where they are being tested and a feedback. So these are, in fact, some rural areas are not even motorable, not even accessible. So these are things we need to look into, and it's a cause for worry, not only in Nigeria, but even in some parts of Africa.
All right. We appreciate your time. Thank you so much, Dr. Shalom Oni, for joining us on the program.
Thank you very much.
We have more of the COVID-19 updates when we return. Please stay with us. Welcome back. Let's take you to Imo State, where our correspondent Eita Kwekuti brings us the latest.
Schools in Imo State will have to wait a little longer before resumption. According to the state government, the resumption of schools have been deferred to the completion of the ongoing community mass testing for COVID-19 across the 27 local government areas of Imo State. The Commissioner for Information and Strategy in Imo State, Declan Emelumba, disclosed this after the weekly Executive Council meeting at the Government House in Owerri, the Imo State capital. He said out of the 27 local government areas of Imo State, about 1,000 persons have been tested across 6 local government areas in the state.
We are happy to report that so far about 6 local governments have been tested. Testing has been carried out in 6 local governments, out of which about 1,000 people from these local governments have been tested, and only a very negligible number of about 24 are found positive. That means that COVID-19 is really low in Imo State. And it's also important to emphasize here that Imo State is one of the few states, one among the 9 states in the Federation that is religiously carrying out this community testing program. And the only one really in the southeast that is religiously carrying it out. So that is very, very commendable.
Hopefully, when this exercise is completed, schools in Imo may resume before the end of the year. From Owerri, the Imo State capital, Eita Kwekuti for COVID-19 updates.
In the meantime, climate strikes are taking place all over the world today. After months of a coronavirus-induced break, protesters will be taking to the streets and social media again to demand action on the climate emergency. To take a closer look at this, Deutsche Welle correspondent Malta Rover-Harman joins me now from Berlin. Thanks again, Kalman. Good to see you. Talk about what's going on in Germany. How are people protesting in Berlin?
Well, here in Berlin, they've organized public bike rides. They've organized a sit-down strike. All, of course, a big challenge with the lockdown restrictions or with the, the social distancing measures that are still in place for demonstration like this. And not less a challenge because it's pretty much a very rainy day over here. But nonetheless, quite a few people have turned out so far. And many have also taken to social media, which is probably the safest option. And organizers have called people worldwide to also do that today, especially in places where there's still a heavier lockdown in place. In Germany, there will be strikes in around 400 towns and cities and across the world in more than 3,000 places.
And I hear there will be some virtual strikes as well. But with regards to the pandemic, how has it affected the movement?
Yes, it seems to have quieted down a little bit over the past few months, which of course is in effect a result of the pandemic and lockdown measures. If you look at the strike last year, the global climate strike they organized about the same time last year, we saw millions of people around the world on the street, and that of course is now completely unthinkable in these times. So what has happened is, yes, the protests have moved online somewhat. But we also kind of have to look at the attention that COVID has taken away from the topic of climate change. I mean, in the beginning of the year, it looked like it was going to be the big topic, the big story of the year. The Swedish climate activist Greta Thunberg had just been named Time Person of the Year 2019. And then the pandemic struck, and it was all about the pandemic, which is, of course, understandable. But protesters today, they are saying, well, while attention shifts to one crisis doesn't mean the other crisis is solved. There are still wildfires, there are still freak weather events all around the world, and that's what they're out to remind us of today.
Which takes us to the next question. Did the lockdowns around the world help lower emissions, especially with less flying and several other things?
Yes, absolutely. That had a massive impact. I mean, economies stood still. As you mentioned, air passenger traffic was down 90% at some point. And also people didn't commute to work because many stayed at home and didn't use their cars as much. So global emissions were down on some days 20%, which is a massive amount. But a recent study looked at the effects that this might have in the long run, and it found that if we go back to business as usual, the effect will be almost negligible. Only 0.01 degrees in global warming less by 2030. The thing to do would be to have what the authors of the study call a green recovery. So start investing in renewable energies, start investing in more sustainable modes of transportation. And that's obviously very much in line what the protesters on the streets and on social media today around the world are demanding as well.
Because we cannot go back to a lockdown. We'd like to thank you, Deutsche Welle correspondent Marta Roa-Kalman. Thank you for joining us. Now, the Center for Systems Science and Engineering at Johns Hopkins University says the total number of COVID-19 cases in the U.S. has surpassed 6.97 million. Here's more on the COVID-19 global update.
The state of California reported the most cases on Thursday, followed by Texas and Florida, respectively. The U.S. Centers for Disease Control and Prevention predicts that COVID-19 deaths in the United States will reach about 214,000 to 226,000 by October. Predictions from the University of Washington also shows that the death toll will increase by 150,000 in the next 3 months. In Germany, researchers say they have identified highly effective antibodies against the coronavirus and are now pursuing the development of a passive vaccination. In Asia, Hong Kong's Disneyland reopened to guests on Friday after shutting down in July amid a spike in local COVID-19 cases.
Not really, because I think the measurement is pretty good today, so we were comfort to just keep our masks on and relax.
The reopening means that Disneyland Resort in California is the only Disney park still closed worldwide. Finally, United Nations Secretary General Antonio Guterres says there is an urgent need for innovative thinking on global governance and multilateralism for the COVID-19 pandemic.
We urgently need multilateral institutions that can act decisively based on global consent for the global good. And we need multilateral institutions that are fair, with better representation of the developing world, so that all have a proportional voice at the global table.
Mr. Guterres adds that the COVID-19 crisis is the result of a lack of global preparedness, cooperation, unity, and solidarity.
Remember that a decline in the cases doesn't mean the curve has been flattened. Continue to take responsibility. Visit our website. It's channelstv.com. There you get more updates. You can find that major story there talking about coronavirus and other deadly epidemics in the 21st century and several other stories there as well. Thank you for watching. I'm Millicent Walker. Stay safe.